Okay, so welcome everybody to Radiologic Procedures Part 2. Let me get your faces pulled up here so I can see you. And by the way, if you guys see me looking up a lot, I changed the layout of my computers where I have the screen with you guys with your faces above me. So if I'm looking up, it's not because I'm rolling my eyes at you. It's because I'm looking up at your lovely portraits on the screen. There we go. All right, so in the first part of this class, before we jump into upper extremities, we're going to do a little bit of a review as well as some new information in relations to osteology and arthrology. But here's the main stuff we will be going over this chapter. We're of course going to identify those different components and the number of bones in the adult axial skeleton as well as the appendicular skeleton, which we did go over to begin with last semester. That's going to be a bit of a review. We're going to go a little further. We're going to start talking about the different classifications of bones as well as the examples of what kind those are exactly, because there are multiple classifications of bones, different bone types. We're going to talk a little bit about that bone development, the osteology, the actual study of how bones are formed. We're going to go over that primary and secondary ossification and the parts of the bone that are developed. We're not going to get super detailed with it, but we're going to go over the main things to make sure you remember as far as the registry is concerned. And we're going to talk about the structural and functional classification of the joints and provide examples of each. And these tend to often trip people up because there are a lot of joint classifications. Believe it or not, throughout our body moves in so many dynamic ways. There are tons of joints that we have to go over in arthrology. We're going to specify those, and these joints will reemerge in every course of Rad Pro as you move forward through your 2 years of coursework. And then we're going to go into a deep dive into those synovial joints, which is a certain classification. Synovial joints opens up a big, wide door of many more joint examples that we'll be talking about. There we go. All right, so this should be a review right here, guys. We have seen this from last semester. When we're talking about the adult skeleton does contain 206 separate bones. Once again, that's one of those numbers you want to make sure you don't forget. That's going to come time and time again. Commit that to memory, put a star on it, make sure you never forget it. That's registry question 101 right there. 206 separate bones located within the adult skeleton. We're of course going to go into osteology, which is the study of bones. We're going to go further into that in a little bit, and arthrology, the study of those joints. Who here can remember how many bones are contained on average on a child's skeleton, like an infant?
270.
That's, you said 240?
270.
270, usually around 270 to 300. You'll see that number vary depending on the age of the child. And I have on here on the presentation 300, but do make sure you make notes because my PowerPoint does not state this. That does vary from 270 to 300 depending on the age of the child. Obviously, the younger they are, the more bones there are because they're developing. They're mostly made of cartilage. As they grow older, those bones begin to fuse, and we get less bones as we move forward and become adults. And I do see some people putting something in the chat. I cannot see the chat right now, so if you have a question, let me know out loud. I can't see your chats while I'm doing the presentation. Daniel, are you trying to say something? I can't hear you.
I got booted out. I was trying to see if you could give me permission to record.
Sure thing. Here we go.
Thank you.
There you go. Okay, so moving on, guys. We're going to talk about the axial skeleton just a little bit, but not much, because the axial skeleton will be our focus when we get to Rad Pro 3. Do remember this other number here, that the axial skeleton does include 80 bones total. One of those numbers you want to never forget, 80 bones total in that axial skeleton. And that's referring to those bones that are along the central axis of the body. Specifically, we're talking about the top of the skull, all the way down to the bottom of the coccyx. That is your axial skeleton. That's going to include the skull, vertebral column, ribs, sternum, other bones as well that aren't listed there. but that is composed of top of the skull all the way down to the bottom of that coccyx. By the way, we're going to be using a lot of our terminology once again. If I'm talking about directional terms, what would be the aspect of the body at the very top up here in directional terms?
Superior?
Superior versus the bottom would be?
Inferior?
Inferior. So the skull would be superior, the coccyx would be inferior. A lot of those directional terms are going to come back as we move forward. Make sure you don't forget those. And we'll be reviewing them, don't worry, if they've slipped your mind. But it didn't slip anybody's mind, right? It's still fresh. It's only been a week off. We should be experts on these directional terms. Yes, Mr. Donahue, I'm an expert on those directional terms. Yes. Okay. At least give me a sarcastic thumbs up. I mean, that's something. Yeah, there we go. All right, so our primary focus, of course, this semester, guys, will be that appendicular skeleton, the appendicular skeletal bones. In total, to equal that 206, 80 plus 126, appendicular skeleton will contain 126 bones total. Once again, remember that number. It's going to come back to you. 126 bones total in that appendicular skeleton. What areas is that talking about? Well, the ones you see highlighted here on the skeleton that are blue, that's of course going to be all of our limbs, upper and lower limbs, as well as the shoulder and the pelvic girdles. And it doesn't look like much, but there is a lot of bones located in that appendicular skeleton, which is why we spent an entire semester only on the appendicular skeleton. We got a lot to go over. Uppers, lowers, shoulder girdles, pelvic girdles. It's a lot more than it sounds. Oh, by the way, for review here, guys, what is this position known as that the skeleton is standing in?
Anatomic position.
Anatomical position, yes, anatomical position, because the palms are facing outward, the feet are forward, they're standing erect. That's that anatomical position. Very good. Okay, so let's start getting into osteology a little bit here. This is going to be a lot of that, high school biology stuff that you guys, I know, remember like experts, as well as some of that A&P stuff that I know you, once again, know like experts. You hear my sarcasm there. It's okay. We're going to review the main points that you need to know just for your registry. So we're going to talk about the different parts of the bone. We're talking about bone composition. This is an example of the humerus right here, which is one of our long bones. The first part is going to be what we call the compact bone. That's basically, in layman's terms, the outer shell of the bone, the very hard part. That's the part that you usually see that's fractured on bones. That is that hard outer shell surrounding the entire bone, that compact bone, which is this region right here. It's that outer layer, the compact bone, right there. Now, below that, in the central portion of the bone, is what we call the spongy or cancellous bone. It's called that because it literally looks like what? It looks like a sponge. It's porous, just like a sponge would be that you wash your dishes with. It's what we call our spongy or cancellous bone. Key thing to note here, though, when we talk about the spongy or cancellous bone, it has a key feature in that it contains the red marrow. It contains the red marrow. You definitely want to remember that point right there. When we refer to the body of the bone, moving on here, the body of the bone is this entire portion that I'm circling right here. The longest portion of that bone is what we call the body of the bone. The upper two portions, which we're going to talk about this a little later, is what we call the epiphyses. The two ends of the bone is called the epiphyses, but we're going to come back to that in a little bit. Do you remember this main long portion here of the bone is what we call the body? That is the longest portion of the bone on that bony composition. Now, directly in the center of the bone, not to be mixed up with the spongy bone, we're talking about this central location right here, where you see these little arteries and veins. That's what we're going to call the medullary cavity. That's that central cavity in the center portion of that bone shaft. And that is where that red bone marrow is going to be formed. Even though the spongy bone contains red marrow, make sure you know and have a key difference of knowing this, that the medullary cavity is where that red marrow is actually formed. So the formation of that red bone marrow and the yellow bone marrow, we're not going to talk much about yellow bone marrow because that's more adipose tissue, but that red bone marrow is stored in that medullary cavity. It's created in that medullary cavity, rather. Created within that medullary cavity. Moving on here, we're going to talk about what's called the periosteum. The periosteum is a dense layer of vascular, keyword vascular, which means it contains veins and or arteries, vascular connective tissue enveloping the bones and creating, except for the surfaces of the joints. Also, it's not labeled in this definition here. I want you to make sure you remember this. The periosteum is a connection point for arteries and veins into the bones. It's a connection point. And it looks like a very thin sheet on those bones, almost like a wrapping paper that goes around the bones. It's very thin, almost like that shrink wrap you put around a sandwich. Same concept, but it's actually a connection point for those artery and veins that are traveling inside and outside the bone. It's the periosteum. And then finally, we're going to break these down a little further in the next few slides, but finally, as far as the classifications of bone composition, we have what's called the articular cartilage on the very end of the bone here. That's that little blue part you see right here. That's called the articular or hyaline cartilage. And that acts as a cushion for the joints of the bone, so that the bones don't rub up against each other and wear away. We have that articular or hyaline cartilage acting as a padding or a pillow. I think of it as a pillow to cushion those bones so they don't rub up against each other and erode the bones away. So you ever see someone that has a lot of joint pain? Typically that means that their cartilage has worn away, especially people with the knees, and those bones are literally grinding up against each other because that padding is no longer there. That articular or hyaline cartilage is there to keep that from happening. It's that padding or that cushion for those joints to keep those bones from grinding up against each other. All right, moving on here. So there's just a little bit further, a bit of definition for that compact bone versus spongy bone. Make sure you make note that the compact bone goes by a secondary name of what we call cortical bone. It's one of those alternate names. You need to make sure you know both names, as I've said before in the past. Compact or cortical bone. And it's a much denser material because it actually creates that hard structure of the skeleton so that our skeleton does not collapse upon itself. It's that hard outer shell, once again, of that bone for protection and structure. Protection and structure. It's the main 2 points of that compact bone. And then talking about the spongy bone again, just a few key points here. I already kind of stated these. It's that very porous bone. That's where bone marrow is usually contained, not created, by the way, because bone marrow is created within the medullary cavity. The spongy bone does contain red marrow, and it's always located at the ends of the bone, at the ends, or what we call the epiphyses, not the body. It'll be just the ends right here. So spongy bone will never be located within the body of the bone, of a long bone. That's only going to be the compact bone right here. And then spongy is on either end of that bone. It literally looks like a sponge, with that hard compact bone surrounding the spongy bone. So compact bone, key note here, is found throughout the entire bony structure, but the spongy will only be at the ends of both ends of that bone. We'll start talking more about those epiphyses here in a little bit. That's just another example of what we're talking about there, guys. There's that spongy bone, once again located at the ends of both sides of the bone, top and the bottom. There's your spongy bone. The compact bone surrounds the entire structure. And then that medullary cavity is right there in the middle where that red bone marrow is formed. So medullary, spongy, and the entire structure contains the compact bone. And that's just showing you a closer look of what that periosteum looks like. Once again, that's a place where the vessels of the body will adhere to the bone to create blood supply inside and outside the bone. It really looks like a thin, thin sheet, like that plastic wrapping, once again, that shrink wrap. I always think of it like shrink wrap. It looks like shrink wrap. It's surrounding that bone. It's a very thin sheath, but it's that connection point for those vessels within the bone. And there's another closer look there, guys. You don't need to know all these words yet. That's coming when we get to lower extremities. But showing you what that articular cartilage or hyaline cartilage looks like close up. Once again, remember, the main function of that cartilage is to create that padding between the bones and the joints so those bones don't rub up against each other and erode the bone away. Okay, so keynote here, this is everything we just talked about, but we're going to talk a little bit more about the epiphyses and the diaphyses. So one thing to remember, we're hearing the words epiphysis and diaphysis. Diaphysis is referring to the region of the bone that we just called the body. The body and the diaphysis are the same location. The epiphyses, there's always a proximal and distal epiphysis, are always found on the ends of that bone, like you see right here. And that's also that same location where we have that spongy bone located. So diaphysis is literally the body of that bone. It's an interchangeable term. It's referring to that long region. The epiphyses are found on the distal and proximal ends of that long bone. And a great question is, where is spongy bone located? If I wanted to use a fancy term, you could say it's actually located in the epiphyses, that spongy bone. Also, something to make note of with the epiphyses is that's also where we have what we call our epiphyseal lines or epiphyseal plates. We'll talk more about those when we get further along here. That's something you're going to see a lot in pediatrics, the epiphyseal plates. All right, so now we're going to move on to our actual bone classifications. We have several classifications we have to go through. The first one we're going to talk about is what we call the long bones. This is literally referring to the limbs, upper and lower extremities, such as the humerus, the radius and ulna, the tibia fibula, and the femur. Those are all considered long bones in our upper and lower extremities. They are always composed of compact bone, the spongy bone, and the periosteum. In fact, everything we just looked at on that bone classification, that bone structure, was an example of a long bone structure. So long bones are literally that. They're the long bones within our body. Whether we're talking about our arms, our legs, that's those long, long, thin bones that are providing structure and movement with our limbs. Helping us to stand, helping us to move around, giving us that 360-degree movement. As we move on, we're going to have other classifications that have very distinct functions as well. So there's a little bit further of a definition for you guys. Those long bones are directly involved with those very large movements, the very large movements. And they are elongated to serve that purpose of those large movements. They have the knob-like ends, which we call those epiphyses that we just talked about. And they're always going to be composed of that spongy bone covered by that layer of that compact bone. And this right here is a list of what is considered the long bones. You do want to make note of these because this makes great questions right here. We're talking about the clavicle, the humerus, that radius and ulna, the metacarpals, the phalanges, which are our fingers or digits, the femur, tib fib, metatarsus, and the phalanges, which are also our toes. All those are under the classification of those long bones. So great questions I can ask is, what classification does the clavicle fall under? You would tell me that is one of the long bones. We're going to talk about more as we move on, but you do want to make note of knowing these different categories of these bones, because once again, that is great registry questions that they may ask you when they're talking about bone classification. I can almost guarantee you they'll ask you what classification the femur falls under, because they love to ask questions on the femur. Femur is quite easy because that's the largest bone in the human body. That's also the longest bone in the human body. It falls under that classification of a long bone. So moving on here, we have what's called the irregular bones. They're called irregular because they're just that. They actually look very irregular. They're what we call the peculiar shapes within the bones of the body. Some examples of those would be our vertebrae, our facial bones, and our pelvic bones. They all have completely different distinct shapes, whereas the long bones all have very similar structures and looks to them. Those irregular bones are all completely different from one another. That's an example right there on the right side. And we'll talk more about this next semester, but does anybody know what kind of bone this is specifically? Does anybody want to wager a guess what that is?
Cervical.
I think I heard somebody say it. Say it again.
Pelvic bone.
You said pelvis?
Yes.
So it's not a pelvis. Good guess.
Is it a spine bone?
You said spine? It is a part of the spine. In fact, it's a specific,
Axis.
it's a vertebrae.
One.
Axis.
Does anybody know what vertebrae that is?
The second, first or second? I think.
You're close. That's just a regular cervical vertebrae. That could be either 3 through 7 because they all have similar shapes.
C3.
It's either 3 or it's 3 through 7, any one of those. 1 and 2 have more distinct shapes than that. But we'll get more into that next semester and all the parts of that vertebrae. So there's your definition, guys. The irregular bones, they do not fit into those previous categories because they are those very peculiar and strange shapes. Now, as far as their composition, they also have that compact bone layer, but the entire irregular bone, whereas the long bones have the spongy bone on the ends, the irregular bone has the spongy bone in the entire interior, entire structure within. So that entire irregular bone is composed of that spongy bone surrounded by that compact bone. That's just those same examples that's talked about, guys. It's some of those vertebral column bones, the pelvic girdle, the face, and there are even more than what's listed there. There are quite a few of those irregular bones, especially when we're talking about the facial bones. There's tons of them.
And you said that the whole interior of the bone is spongy?
Correct. So in a difference from that long bone, the irregular bones have an entire spongy interior, whereas the long bones have a spongy interior only on the ends where the epiphyses are. Irregular is the entire central structure is full of that spongy bone, surrounded by the compact bone. And there's some examples right there of what those irregular bones would be. That's going to be any of our facial bones listed here. That's going to include that hyoid bone, which we talked about last semester, which is located in that anterior portion of the neck. Of course, all of our vertebrae, every single vertebrae from C to T to L are considered irregular. And of course, the sacrum and the coccyx. Every one of these bones are distinctly different from one another. That's why they're called those irregular bones. And I'm just going to say, because we did talk about this one last semester, you might want to remember that one right there. So we should be quite familiar with that bone by now. And that's just showing you a little bit of a closer look at what those vertebrae look like. You don't need to know the anatomy on these yet. That's next semester, but I was just showing you what they looked like. But do make sure you remember this one. We have talked about this one. That's that hyoid bone once again, located in the neck. Okay, short and flat bones. We do classify these together, even though it's talking about two different types of bones. When we talk about short bones, we are specifically referring to, and we're going to learn all of these very soon, the carpal and the tarsal bones. Carpal bones are located in our wrists. Tarsal bones are located in our feet. That's going to be your short bones. Called that because they're very tiny, very short. And then we're going to talk about flat bones. When we talk about flat bones, that's referring to what's called the calvarium, which are specific bones in the skull and face, the sternum, the ribs, and the scapulae. They are called flat bones because they're just that. They are flat in their structure. Yes, the ribs are flat. A lot of people don't realize the ribs are quite flat in their structure. Thin as well, very thin. That's why they're so easy to break. Okay, and this contains the definitions of those short and flat bones. It also has the long and irregular for comparison's sakes. Those short bones are generally going to be more of a cube shape, and they're obviously very short, very small, and their structure is a containment of mostly spongy bone. So different from those long bones, once again, where that long bone has different sections that are spongy versus compact and medullary. The short bones are mostly going to be composed of spongy bone as a whole. The flat bones are literally that. They're flattened shaped bones. They're very thin. They're usually quite curved in nature. If you think of how the skull works, the skull has curves all over it. The ribs curve. Even the sternum curves to a certain extent. And their structure is a very thin layer. That's a key word, a very thin layer of compact bone surrounding spongy bone. So one easy way to remember, guys, when we're talking about these different shapes of bones, the short, the flat, and the irregular are all fully composed of that spongy bone. The only one that is not is the long bones. Long bones are only composed of spongy bone on the ends, that proximal and distal ends. That's an easy way to remember those, if it's all running together a little bit. By the way, you can see why this is called an irregular bone, right? I mean, doesn't that just look crazy? That's one of my favorite bones right there inside the skull. It's what we call the sphenoid bone. I always thought it looks like a bat. You see the bat? I think it looks like a bat or a butterfly. Very cool bone, very important bone. It's one of those, this one bone here contains like so many pieces of anatomy, but it's always a lot of fun to study it. We'll do that next semester. One of my favorite ones to talk about. Okay, so here are the flat and short bones that we're talking about. Flat bones are on the left. That, of course, is talking about those bones within the skull. Don't confuse those with the irregular, by the way. The skull does have, or sorry, the facial bones are considered irregular. The skull bones, skull and facial are two different sets of bones, by the way. The skull bones are going to be what we call the flat ones because they're flat and curved in nature versus those facial bones, which will all be irregular shapes. Of course, the scapulae, the sternum, the ribs, and the hips as well. Those are all fall under that flat classification. And then those short bones, once again, that's going to be our wrist bones, our foot bones, which are called the tarsal bones. And I didn't list this one before, but it's also going to be talking about the patella, the patellae, plural, patellae, not patellas, patellae, are your kneecaps. It's a fancy way of saying a kneecap, patella. Those are also called short bones. Patella is always going to be the largest short bone, while the carpals and tarsals will be much smaller than that. And that's showing you a little bit of a closer look at those short bones. Once again, that's all those carpal bones that we see right here. We'll be memorizing these in the next chapter. Located in our wrists, that's showing you that composition once again. Once again, those short bones are completely filled with that spongy bone, surrounded by that thin layer of that compact bone on that outer surface of it. And there's an example of those flat bones one more time, showing how they're flat in nature, also curved. That's those cranial or skull bones, sternum, the scapulae, that's talking about both, and the ribs. Every single rib is considered a flat bone. Okay, the last one we're going to talk about here as far as the classification of bones is what we call the sesamoid bones. Now, I know how I always have my favorite stuff to talk about. When we're talking about bone classification, I love talking about sesamoid bones. Why? Because I always said the easiest way to remember about a sesamoid bone is they look like little sesame seeds, which is why I include a picture of sesame seeds down here. You will see them on different parts of the body because they do develop as a response to friction, where we have a lot of friction. So especially in the feet and the hands, people will develop sesamoid bones. Their specific purpose is to embed, oh, Daniel got kicked out. There you go, Daniel. To embed certain tendons, and they do always develop due to friction, where we have friction on the surfaces of our bodies. Keynotes, the patellas, patellae, the two kneecaps we have are the largest sesamoid bones found in the human body. You don't want to forget that right there. But you will often find them close to the big toe. They look like little circles, little sesame seeds that develop on the toes. You'll also see them on the hands, on people's fingers. They develop as well. You'll even see them on random locations within the body. You'll see them sometimes on the femur. You'll see them sometimes on a tib fib. Literally, no two sesamoid bones are the same because they actually develop as we go through life, depending on how much friction is placed on those bones. So you'll see sesamoid bones pop up on people in random places all over the place, all the time. But I do always like to point out those sesamoid bones, especially in the feet and the hands. So do take note. That's one of my favorite things to ask. And make sure you know that the patella is the largest sesamoid bone found in the entire body. And their main function is that connection point for tendons.
So the patella is considered sesamoid and the short bone?
Correct. Correct. I'm glad you brought that up, Jonathan. That's one of the few bones that falls into two categories. It falls under the short category as well as a sesamoid bone. Yes. Thank you for bringing that up. I forgot to mention that. Very good. Very good. So as far as what you need to remember, guys, that is the one bone that I'm going to ask you guys to remember does fall into two categories. Everything else we've talked about will fall into their singular category. Patella goes under short bone and patella for classification. And that's just showing you right there, those sesamoid bones located on the metatarsal, close to the big toe. Once again, showing you that is that connection point for tendons. And yes, tendons and connection points form as we grow. So sesamoid bones do pop up in different locations of the body, depending on where we need those tendons to be formed within the foot, the hands, or other locations of the body. The sesamoid bones will pop up all over the place. You'll see them in some of the most random locations sometimes. This is showing you what it would look like in a hand. You have a nice arrow pointed out to you there, but the most common location of a sesamoid bone in the hand is going to be right by the thumb right here, or more specifically, by the first metacarpal. This is a metacarpal, by the way. It's going to be that little round shape, looks like a little sesame seed. That's going to be a sesamoid bone within the hand. But you'll sometimes see them right here. By the other metacarpals, you'll see them down here. You even see them up here by the joints of the fingers every once in a while. It's totally random. It's different between every person. So when you see those on x-rays, don't make that mistake of assuming, well, that person's got a fracture because the bones broke off. A lot of times what we're seeing is actually sesamoid bones within the hands and the feet. Very common mistake you'll see a lot of people make. Even technologists make that mistake. And then once again, I'm saying this a lot for a reason. Make sure you do not forget that the patella is that largest sesamoid bone found in the human body. Patella is located right here, by the way, on this AP view. And this is the patella on the lateral view of the knee. Okay, so we're going to talk a little bit further about bone development now. All these different little processes that you see right here, we're going to go into further detail. We're not going to go in extreme detail, but this is more of an overview of this process of bone development that you need to make sure you remember for your registry. So those different steps are what we call is ossification. Ossification is a classification of the entire bone development. This entire process we're talking about, let me color code this for you guys. Ossification refers to all of this together as a whole. Ossification refers to all these steps as a whole right here. When we start breaking it down, we have what's called the primary ossification, the secondary ossification, diaphysis, epiphysis, epiphyseal plates, and metaphysis. So you've seen these before. They're talking about locations of the bone, but they're also in relation to bone development. So they don't only refer to locations, but actual bone development. And we'll talk more about this we see right here as we move on this picture. Now, I want you to make a key note of this right here, this epiphyseal plate. We'll talk quite a bit about this in just a few minutes. It's very important we understand what epiphyseal plates look like. Okay, so we're gonna start talking about ossification, guys. But before that, take 5 minutes, 5-minute break. I'm gonna go get me another water. Go take you a bathroom break, get you a drink of water, get you a snack. 5 minutes, we'll start right back up at 1:56. I'll be right back. All right, guys, let you all get back on camera here. We'll get rolling in just a second.
Mr. Donahue, can you give me permission again?
Yes, sir. Welcome back. Welcome back. Hang in there, guys. I know it's the end of the day, but we're about to wrap it up for the day. Not much more to go today. Okay, so I got a great question in the chat here. And this person said that one thing that just crossed my mind while I was at clinic was that the techs don't use their markers at all. They mark them digitally. And I was confused because I didn't want to ask them, but I remember you said that we should never digitally mark an image. Can anyone else echo that and say they saw a lot of techs marking digitally?
I
Very,
didn't even have markers on her at all. She just digitally analoged everything.
very lazy, disgusting habit, to put it bluntly. So while that is an option, yes. I'm sorry, Jaleisha, is your cup bloody? It looks bloody.
Yes, it is.
That's kind of cool looking. I'm sorry, it distracted me. Very bad habit, guys. So yes, what I said is true. And don't let that fool you, because the registry will throw a question like that to you about digital annotation, because it's a very bad habit that has trended hard with text today. Is that, I'll read you what I just saw in the chat just now. It made me laugh. You'll see a lot of texts not using those markers. Why? Because, hey, it's got the convenience of the digital marking, but that is not a safe practice. If anything legal were to happen, that could cause so many ramifications, and heaven forbid that happens to anybody, that could actually cause someone to lose their job. So from a legal standpoint, it's better safe than sorry. Make note, you're going to see all these texts failing to use markers, but please, I implore you, when you become a technologist, don't be that way. Use your real markers, because I don't want anyone here to lose their job, and you're opening up a whole can of worms if you start doing that lazy habit. So this other person in the chat just said, my tech wasn't the best at washing their hands either. So can anyone else echo that? As in they didn't really do it at all. That's kind of scary. That is kind of scary. Obviously, guys, hand washing, a very important detail. We talked about that this morning. Please do not pick up that bad habit. That is not a good habit to have. There are so many toxic things out there that can infect you and you can bring home with you. Wash your hands. I know we get busy. You'll see these techs get stressed and busy. They'll use that as an excuse. There really isn't an excuse to not wash your hands, whether we have COVID going on or not. Better safe than sorry, guys. Don't do it. Sanitizer is okay. Sanitizer is considered okay. I would still personally wash my hands with soap. That's just me. But they do consider hand sanitizer as an okay forms of washing your hands for 30 seconds.
I made them use their markers just because he asked me to do it, and I was like, okay, I'll do it. Can I use my markers? And he's like, you don't need that. I'm like, okay, because I was under direct supervision. I was like, I'll use your markers anyways. I don't feel comfortable doing it without markers. And he just let me borrow his markers at the end of the day.
Good answer, Esbete. Good answer. I'm glad you said that. That should be your response, because they may tell you, don't worry about it, but your response should be, I feel comfortable using my markers. It's how I was taught. That was the correct answer. Very good. Very good. I'm proud of you for saying that. Okay, so now we're getting some more stories coming out now. Why didn't y'all share this with me earlier? Don't worry, what's said in here stays in here. I'm not going to repeat what you said. This is the truth room, where we can say whatever we need to say.
Mr. Donahue, would that be the same for fluoroscopy? Like, because I noticed that on the image of the of the C-arm, they already have the marker on the image.
For fluoro and C-arm, it's not required. Mostly it's just for plain film X-ray that you want to put markers.
Okay.
And the reason for that is if you're putting a marker on a C-arm or a fluoroscopy machine, because of the nature of those x-rays, if you notice, it's like the video x-rays, it can cause what's called a streaking artifact. It'll streak across the image and actually mess up the image. So it's generally not recommended to use markers on fluoro and C-arm, although some people may still do that. It's just reserved for those plain film x-rays most of the time. Yes. All right, any other questions before we get back onto the lecture here, guys?
Yes, sir. I have a question about ossification. You said it's a growth of bones, and so like how can I say it? So the primary, secondary, and diaphysis are all the steps to create the bones, right?
They're part of the steps, yes, but for diaphysis and epiphysis, they're part of the bone formulation process, but they also refer to locations of the bone. So they kind of have a dual purpose in the words there. But yeah, ossification as a whole is referring to that bone development process. Primary and secondary ossification, we're about to talk about that a little bit further here when we get started again. We're going to get into more specifics of that. All right, so let me go ahead and get that pulled back up, speaking of which, and we will finish out our day here. All right, here's where we left off, guys. So when we talk about ossification as a whole, once again, we're talking about that process of bone formation. How's that done? That's done by what we call the deposition of calcium, because bone is made up of a lot of calcium. You always heard when you're growing up to drink your milk because it has lots of calcium, makes your bones strong. It's that deposition of calcium in what's called the fetal hyaline cartilage. Fetal hyaline cartilage is referring to an infant's bone structure because it's mostly made of cartilage. We're depositing calcium to formulate that hard bone structure to transform it from cartilage to bone. Now you'll see in this diagram right here, there are tons of steps, tons of complex areas of how that bone is formed. I don't need you to know all this. We could talk all day on this, and I would love to talk about it, but it's not essential for your registry. The main thing you need to remember here, guys, is this definition right here of what ossification is. We're not going to go into all these steps. We're just going to talk about what the definition of it is. Make sure we know ossification refers to that formation of bone by the deposition of calcium into the fetal hyaline cartilage. And also to make note, guys, all bones, oh, my star was terrible there. It's hard to draw with a mouse. All bones develop from the mesenchymal tissue of the embryo. All bones develop from the mesenchymal tissue of the embryo. So both of these statements here, guys, make sure you know those. Don't worry about this picture right here. But if you do want to know about it, it's there for your reference. If you want to know how that ossification takes place and all the steps, I've got it right there for you. So when we talk about the primary ossification versus secondary ossification, once again, ossification refers to what? That formation of bone. We have two main locations this occurs, is what we call the primary ossification center versus the secondary ossification center. So ossification is formation of bone. When we say the primary ossification center, that's referring to the body of the bone, the main portion of the bone or the body. When we talk about the secondary ossification centers, we're talking about the areas near the joints or the epiphyses of the bone. That's our secondary ossification centers. So bone is developed primarily in the main shaft, body, or diaphysis. It's formed secondarily at the joints, the ends, or the epiphyses. That's what is referred to as the primary ossification center versus the secondary ossification center. And as a whole, if we talk about both together, it's just simply called ossification. By the way, does anyone see something funny on this image? I want to see how your QA, QC eyes are. We're going to start developing these as we move forward. Does anything stand out to you in that image that you see? It's peculiar. Look closely.
Wouldn't the radius and the ulna be more close together, or maybe I'm just not looking at it right?
Well, first off, rethink of what we're looking at because it isn't a radius or ulna.
Is it the foot? I can't see. I'm on my phone because it kicked me out. So.
This is a tibia and fibula.
Oh, okay.
Big gap
There's
between
no
the
markers.
femur.
Joints are not together.
Wait, say that again, John. John, what did you say?
There's a big gap between the femur and the tibia and fibula.
Good observation, but that's normal. That is normal. That's supposed to be there.
There's no markers.
I wasn't going to mention that, but yes, you are correct, Tracy. There isn't a marker on there. Very good. So I wouldn't want to pass that either. But there's still something peculiar on the tibia specifically. Let me circle the tibia in case we don't know what the tibia is, guys. This is the tibia. There's something peculiar on this bone.
Is there a fracture on there?
Very good, Amy. There is a fracture. Do you know where the fracture is?
It's where the second arrow of the primate, where the box is at. That's, yeah.
Right there. You guys see that? That's what we call a hairline fracture. Very small, very thin fracture. So you're going to learn to be able to spot that from a mile away, guys. It may have been hard to see now, but as we develop our QA, QC eyes, that stuff's going to stand out to you really quick and you'll see it immediately. We got to look for those things because remember we talked about last semester, we've got to document everything we see thoroughly to make sure that we're informing that radiologist of what's going on. So this would be a distal hairline fracture of the tibia. Why is it distal? Because it's closer to the foot. It's away from the central axis of the body. Distal hairline fracture of the tibia. Okay, so talking about more of this development, guys, when we talk about diaphysis, do remember diaphysis not only refers to that main body of the bone right here, but it's also the main formation point of bone marrow and bone development within the entire bone. That's that main portion of bone development, diaphysis. The secondary ossification center or secondary development point is what we're going to be calling the epiphysis, which are those proximal and distal ends of the bones. So that primary ossification, the main area of ossification is the diaphysis. The secondary ossification, secondary formation of bone is in the epiphysis or those distal proximal ends of the bone. And then not to be confused with those because very similar words, we're going to talk about what's called the metaphysis. Metaphysis is another area of bone development. It's also a region of the bone. Specifically, the metaphysis is where the diaphysis joins the epiphysis. Say that 3 times fast. That's a tongue twister. The metaphysis is where the diaphysis joins the epiphysis. They connect together. In other words, this point right here, we have the epiphysis, we have the diaphysis. The area they come together and join is that metaphysis. It's that junction point between the 2 areas of that bone ossification. Another key note, the metaphysis only appears in mature bones. And the reason for that is because of the growth plates that we're going to talk about in a little bit in children, where the epiphyseal plates or growth plates are located. They develop into that metaphysis, that junction point. And this word's misspelled, but articular cartilage, once again, that's that padding between the joints to keep those bones from rubbing against each other and eroding away the bone. It's located on the proximal end and that distal end of those long bones. And just to see if you're listening, guys, who remembers what this region in the middle here is called where the bone marrow is formed?
Medullary cavity.
Very good, medullary cavity. What was that thin sheet around the bone that's like shrink wrap that the vessels connect to?
Is it the periostinum?
Periosteum, good, close enough. Very good, periosteum. Okay, so let's talk about those epiphyseal plates. Now, I love to talk about epiphyseal plates because people mistake these things for fractures constantly. When we deal with pediatrics, obviously a child does not have fully developed bones. Those areas at the ends of the bones that look like cracks are actually what we call epiphyseal plates or growth plates. They're very distinct in pediatrics. And I want you guys to develop an eye for seeing these, because I promise you, whether you're a student or a tech that's been doing it for years, I've seen techs, even when I worked at Texas Children's of all places, mistake these for fractures, but they're actually epiphyseal plates. So they do have interchangeable words, epiphyseal plate or growth plate. Both are considered correct terminology. You can use both interchangeably. Make sure you know both terms. What is it exactly? That's that thin layer of cartilage that lies between the epiphysis and metaphysis. And it's where that growth of those long bones will actually take place, where those bones will fuse together to form that entire long bone as they become an adult. So if you look here on this x-ray, this is an x-ray of the knee. We have an epiphyseal plate right here on the distal end of the femur. We also have an epiphyseal plate on the proximal end of the tibia, or the epiphysis of the tibia, epiphysis of the femur. See how I can use those terms interchangeably? They both mean the same thing. So when we're looking at these growth plates, guys, I want you to develop an eye for this, because did anyone see this on an x-ray yesterday, by the way? Did anyone do anybody that's young that had epiphyseal plates? If you have not yet, you will. And one thing I don't want you to do is you do an x-ray of a wrist like this. Actually, it's a very poorly done wrist, by the way, because this is crooked on the film and they got too much of the forearm included. Don't do your wrist x-ray like this, by the way. Last thing I want you to do is be in clinic. You see a wrist pop up like this and you're like, whoa, let's say your tech is Mr. Smith. Mr. Smith, look at the fracture on that radius. He's gonna look at you like, did you just call that a fracture? That is not a fracture. That is a growth plate on that child's wrist. That is the epiphyseal plate or the growth plate. But you can see how it'd be easy to think that was a fracture if you didn't know what you were looking at. Those growth plates will always be present on those distal and proximal ends of those long bones on children, and often will last all the way until they're close to preteen age, where they'll start to fuse together. And I'll show you what that looks like as it fuses. It actually becomes a very distinct little line across the bone that looks like it's completely fused together. But don't get excited when you see this. This is not a fracture. This is normal. We all had these when we were children. These are those growth plates or epiphyseal plates on those distal and proximal ends of those long bones. Another example right here. This is an x-ray AP view of the ankle. Can you see the epiphyseal plates without me pointing to it? It's those distinct, almost look like cracks going across the distal ends of those bones. This would be an epiphyseal plate on the distal end of the tibia. This would be the epiphyseal plate or growth plate on the distal end of the fibula. They're not fractures, they are growth plates. And Tracy, I'm gonna point it out before you do this time. Yeah, there's no marker there. That's why you gotta put those markers, guys. You get used to doing those annotations, you'll end up sending an x-ray that looks just like this with no marker, and then that radiologist is gonna call you on the phone and curse you out because you didn't mark it. So don't make that bad habit. And I did tell Jaleisha the other day, she has the distinct dishonor of having the same initials as me. So Jaleisha, every time I see one of your x-rays, if it has JD on it, you know it's gotta be at top quality, right? You can't do dishonor to the JD initials. No pressure, no pressure. I'm just kidding, I'm just kidding. Once again here, guys, this is the difference between a patient with the open growth plates versus the closed ones on the right. It's a little hard to see on this image. I got a better image coming forward here, but when it's closed, there's an actual distinct line that goes across those proximal and distal ends of the bone right there. You'll be able to see that on a lot of the x-rays, especially on teenagers because they're more freshly fused compared to an adult. But once again, even if you see that line going across there, that's not showing you a fracture. That's that growth plate that's fused together. And that's what it's going to look like on the fused epiphyseal plate on an adult ankle. It's a 3-view ankle, AP, oblique, and lateral. But remember this for your image reviews, guys, because as we go through these different pieces of anatomy on the different anatomy for the upper and lower extremities, you can guarantee I will be pointing out these growth plates. It's one of my favorite things to label. It's important to know because the registry likes it too. Whether it's open or closed, you see those lines or those open spaces, that's going to be a growth plate or epiphyseal plate. There it is right there. There it is right there. So that would be an epiphyseal plate or growth plate of the tibia. If it was on the fibula, you would label it as the fibula. A little harder to see on the fibula, but it's right there. Not to be confused with this right here, which is a completely different piece of anatomy. That's your ankle joints, also called the mortise joints. Know the difference between the two. We'll talk more about that when we get to the lower extremities as well as the upper extremities. And this is what an actual fracture would look like, guys. You will develop this as you move on. You'll develop the eye for this, but a fracture is going to be more distinct in the way it's shaped, in the way the bone actually splinters apart. And also, most of the time, it's not going to be that close to those growth plates. Most of those fractures will be more distal or proximal to the actual broken location. Has anybody read ahead on their upper extremity anatomy, by the way? Because we got to learn these starting next week. Does anybody know what carpal bone that is?
Scaphoid.
Scaphoid.
Very good. That's the scaphoid. How about this one right here?
Lunate.
Very nice. The lunate. What about, I love this one. It's the smallest one. It's super.
Pisiform.
The pisiform. Very good. Somebody's been reading ahead. Okay. Okay. And what's the name of the largest carpal bone? Uh-oh. Man, y'all had me excited for a second.
Trapezoid.
Wait, what'd you say, Jonathan?
Is it the capitate?
It is the capitate. Correct. It is the capitate. Don't worry. We're going to go over those very specifically next week. We're going to learn all those carpal bones inside and out. And that's just showing you what a fracture would look like in the ankle, guys. Can you see the fractures versus the growth plates that are fused? Here's your fracture. Here's your fracture. The growth plates are right here. And a little harder to see on the fibula, but the growth plate's right there. We'll learn more about those as we get into the actual extremities. All right, guys. I can see it all over your faces. You're tired. I am too. We're going to end right there today. On Friday, we will pick up with arthrology. We've got a lot to talk about on arthrology as far as the joints, the joint classifications, and the different movement types. So get ready for that. And then starting next week, we will get deep into upper extremity anatomy as well as all the upper extremity positioning. Are there any questions about what we talked about today?
When did you say the epiphyseal plates, like they seal? What age range?
It depends between the different patients. There's no distinct age, but most often it's around the preteen ages, like 10 to 14 is where that full fusion is going to start taking place. But it does vary because everyone has different ways they grow, different rates they grow, and there's no specific age for that.
Okay, gotcha.
Mm-hmm.
Mr. Donahue, after you talked about the irregular bones, what other topics were you talking about? Because I got knocked off, unfortunately.
We talked about the short and flat bones, which are another classification. But there was the long bones, the irregular bones, and the short and flat bones. And then we got into ossification after that.
The sesamoid.
What was that, Esbeti?
The sesamoid bones. After short and flat bones,
I'm sorry, yes.
sesamoid.
And the sesamoid. And I know Jaleisha is putting all these videos on YouTube. Jaleisha, if you don't mind, can you share that link in the chat one more time for everybody? That way, if they weren't able to record, they can access those videos. I'm glad y'all are doing that, by the way.
I can't make it public. I can share it with you again.
Oh, okay. Well, get with each other, guys, because I know some of you guys have been able to record it successfully. If you're missing the recording, talk with your peers, share that however you want to, and make sure everyone has access to that. Make a group me if y'all ever use group me. It's a great app.
If everyone just looks up radiology class of 2022, it should pop up.
Perfect. Perfect. Can't see the I can't see the chart. I'm not sure what you mean. I'll wait for that response. Were there any other questions while I wait on that response? Any other questions? All right, guys. Well, I look forward to hearing about clinic when you go back tomorrow. Can't wait to hear the news stories. We will get right back into all this on Friday. If you have any other questions, please let me know. I will send you the PowerPoint thus far. You should have all received the one from the class this morning. I'll follow up with this one as well. I will see you guys on Friday. Have a wonderful evening and a wonderful day at clinic tomorrow. Bye-bye.